Well, a recent report shows Alberta is struggling with a serious nursing shortage, with staffing levels in the province falling well behind other jurisdictions. One of the most rare health professionals in Alberta are nurse practitioners, with 15.4 such professionals for every 100,000 people. Joining us this morning to talk more about this is Jennifer Mador, president of the Nurse Practitioner Association of Alberta. Good morning, Jennifer.
Good morning. Thank you for having me.
First, in your view, what is behind this shortage?
So we need to incentivize the profession. We pull from the registered nursing pool of professionals. The nurse practitioner education is a 2-year master's degree, which enables nurse practitioners to be able to diagnose, refer as necessary, prescribe any medications, and that pulls from the registered nursing pool. So we need to ensure that we're incentivizing taking on that additional medical legal responsibility. And currently the salary band is overlapping with our most senior registered nurses and entry-level NP practice salary banding. And it's not just compensation that needs to change, it's work environment and it's compensation models. So if we can incentivize the job, not just from a compensation standpoint, but to ensure that there's an environment that people want to work in, then we can increase these numbers.
Yeah, 15 for every 100,000 people, that's a big difference. What does the shortage mean for those who are trying to access care?
So Alberta in general, who are trying to access, for example, a primary care provider, it's very challenging in Alberta. We have, I think it's 2.4 for every 100,000 in the province, and so the OECD average is 3.7. So whether you're accessing a nurse practitioner or a family physician, our numbers to be able to access the services that we need is lower in Alberta. So we need to maximize the scope of all of our health professionals, not just nurse practitioners, to ensure that Albertans get the access that they need.
And the province has called this report biased and misleading. What's your response to those comments?
So the Preszler Injury Lawyers firm didn't draw this data by themselves. They got it from the Canadian Institute for Health Information, which is a reputable source. The data, I will agree, is a little bit outdated. It's from 2023. So we do have approximately 1,000 nurse practitioners in the province, Alberta, to date, which is significantly improved. And that's because of the NP primary care program that was the first of its kind to be launched in Alberta. And that is a win for this province. However, we haven't incentivized it enough, and we need to create legislative changes that support the scope of practice for nurse practitioners. So that means making sure that nurse practitioners can sign off on all forms, that they are compensated appropriately for the work that they're doing. There's certainly a lot of interest, but we need to make sure that they are supported to do the work that they need to do.
Okay, Jennifer, thank you so much for your time this morning.
Okay, thank you.
That's Jennifer Mador, president of the Nurse Practitioner Association of Alberta.